Did you know that almost everyone gets an infection when they have unprotected sex? Yes, they do. We do not know this because some of these infections are silent. Among are the human papillomaviruses, which cause cervical cancer. The cervix is a part of the female reproductive system between the womb and the vagina. Cervical cancer is the uncontrolled, excessive, and random growth of the cells of the cervix. The human papillomavirus and cervical cancer. The HPVs are the commonest sexually transmitted viruses. There are over 100 types and at least 14 cause cancer. HPV 16 and 18 cause 70% of cervical cancer and precancerous lesions. HPV is also linked with cancers of the anus, vagina, penis, and throat. Why should we be worried? Cervical cancer is the second commonest cancer in women in developing countries. In 2018, there were over 570 new cases of cervical cancer globally, and 311,000 died, with 85% being in the developing world. In Cameroon, over 2,300 were diagnosed with cervical cancer, and in 2018, over 1,500 died. HPV is silent but deadly. It could take 15 to 20 years for cervical cancer to develop after an infection. What are the risk factors for cervical cancer? Early first sexual intercourse, multiple sexual partners, co-infection with other STIs like herpes, genital warts, chlamydia, and gonorrhea, intercourse with uncircumcised males, tobacco smoking, excess alcohol consumption, a weak immunity from diseases like HIV and diabetes, a family history of cervical cancer, being overweight, prolonged use of oral contraceptive pills for over 5 years, and low socioeconomic status. What are the symptoms of cervical cancer? Irregular menstrual bleeding, bleeding between periods, bleeding after sexual intercourse, vaginal discomfort or odorous discharge, back, leg or pelvic pain, fatigue, weight and appetite loss, a swollen leg. There is always good news. We can combat cervical cancer through vaccination, screening, and treatment of precancerous lesions. HPV vaccination is ideal in girls aged 9 to 14 years, before the onset of sexual activity. Screening targets 30 to 49-year-old women and younger sexually active females. Some screening tests are HPV testing, pap smear, visual inspection of the cervix. What then can we do? Practice safe sex, delay the start of sexual activity, stop tobacco smoking, limit alcohol consumption, and male circumcision. Almost all cervical cancer deaths can be avoided if we vaccinate, screen, and treat in time. Why should we die from an illness that has a vaccine? Protect yourself.